helping make your life easier. Moms Every Day.
Thanks for joining us here on Moms Every Day. I'm Katie Wilson. Today we have a very special guest. This is Chad Lavender. He is an orthopedic sports medicine surgeon at Cabell Huntington Hospital, also a first-timer, which we always love. Thanks for being here.
Thanks for having me.
Yeah, so we don't have many orthopedic sports surgeons in our area, which is very cool. So what kind of conditions do you treat?
Well, a lot of complex type of conditions, instability and pain in the shoulder and the knee primarily, like rotator cuff tears, labrum tears, and then in the knee, ACL tears, cartilage disorders, meniscus tears, really anything that you can tear in a joint, that's what we treat. And we usually use an arthroscope, which is a video camera that we place in the joint, and we do this minimally invasive.
Okay, so not only are you a sports orthopedic surgeon, but you have also developed a new ACL surgery, is that correct?
Yes.
So tell us about that.
Well, typically, so the ACL is a ligament in the knee that provides stability, and typically we've treated that with a reconstruction where we make tunnels in the femur and the tibia and then place a graft in there. With my technique, we actually harvest stem cells from your tibia. That gets mixed with a bone graft, a biologic bone graft, and what's really interesting is now we can even harvest the bone graft from your tibia and femur during the case. That gets created into this biologic mixture in this composite graft, and then we inject that into the femur and the tibial tunnels before we do the ACL graft. So if you think of a tunnel like a pot that you put a plant in, we're fertilizing that tunnel with this biologic stem cell graft, and so it's really exciting. So
okay, so lots of big medicine words there. So what made you decide to develop this new surgery? Is it faster, more efficient, or anything like that?
So we actually find that athletes have a hard time going back to their previous level of success after an ACL reconstruction.
Got it.
Only about 60% or so will actually go back to their previous level of competition. And the fact that it takes sometimes up to 9 months to recover, anything that we can do to biologically cause a graft to heal in faster would really put us at a higher playing field. So
wow. Okay, so basically your new way of doing the surgery allows people to heal faster.
That's what we think. We've found that at 2 weeks patients actually have less pain. So on average, and we've done over 30 of these, on average they have about 1 out of 10 on their pain scale at 2 weeks.
Wow.
And also we have some MRI imaging and x-ray images that show that the graft seems to be healing and incorporating faster, which if we can have a patient that heals faster, we can advance their rehab and hopefully get patients back as fast as 4 to 5 months rather than 9 months.
Yeah, and I know a lot of athletes really kind of dread that rehab, that stage after the surgery that's kind of holding them back from just returning to sports. So if they can make that go by any faster, I'm sure they would be all about that.
Well, a lot of our patients have came in actually asking us to push them faster. So they'll come in at 6 weeks saying, can I run? And some of them have came in already running at 6 weeks. So it's exciting, and we need to study this further, obviously. So,
okay, very cool. So is this just for a particular type of athlete, or can anybody do this?
That's a great question. Probably the question I get asked the most. And this is for any ACL reconstruction. Okay. So regardless of the type of graft that you use, you can use our fertilization process, our fertilized ACL, on that ACL reconstruction. Young or old, it doesn't matter the age or the type of graft that you choose.
Okay, so we were talking before we got on camera. You said that you've been developing this for years now. So, what's sort of the next step for you?
Well, by far the next step is to study this long term. So doing a prospective clinical randomized trial where we can look at CT scans, MRI scans, and also clinical exams and study these patients as they go forward for several years. Hopefully, within the next several months, we'll be enrolling patients into that type of a study right here in West Virginia.
All right, and you just mentioned West Virginia. Obviously, that's where your office is. Do you want to just remind people specifically where you are?
Tays Valley, West Virginia, and you don't need a referral. Basically, we have walk-ins every day starting at 9 a.m. They can just walk up if something's bothering them or they've had an injury the night before at practice, and just walk right in, and we have a great staff there that's ready to take care of you.
Awesome. Well, Dr. Lavender, thank you so much. He sees all types of athletes, and again, you just heard that information. So watch this again on WSEZ.com and just click on the Moms Everyday tab. Have a great day.